All right, chapter 2. This is going to be human reproduction, anatomy, and physiology. So I would expect most of y'all have a pretty basic understanding of puberty. The main thing you need to remember is that for males, the primary hormone is going to be testosterone, and then for females, the primary is going to be estrogen and progesterone. I'm not going to go through the physical changes. We all know those. The male reproductive organs, pretty basic understanding there. Male genitalia, circumcised versus uncircumcised. Female external genitalia. Next one will be graphic pictures of same. All right, female circumcision, there's no questions on the test about it, but if you ever do go into women's health, occasionally you will see people from other countries that this is a common practice. Hopefully, though, it's becoming less so. I have taken care of a couple of patients that had, they were more like this circumcision right here, like that. So they take the clitoris hood and the clitoris and part of the labia minor. And then they can, after they remove this, then they can sew up. They would actually cut into the edges of the labia minor and then pull them together and suture them shut. There's still enough of an opening that they can pass their menses and so forth. But the main reason why people do this is because it's believed it'll keep women from being promiscuous. If you enjoy sex, then you might be promiscuous, and so that's one of the big things with that. Female internal organs, so this is a side view, and so you've got uterus here. This would be vagina right here, and this area right here is the this area right here. That would be the cervix. You can see that if this uterus had a baby in it, the baby, as it comes down the birth canal, is going to push against the colon, and so this ends up giving the sensation that they need to have a bowel movement. We never let patients just automatically get up if they tell us they need to have a bowel movement if they're in labor, because we need to check and make sure it's not baby coming down instead. Here is bladder right here, and we got an ovary and fallopian tube up here. So just know that, of course, you can see where the bladder's at, that if there's a baby sitting on top of it, that's why women have to frequently urinate during pregnancy. So this is another picture of a uterus, and what we've got here, here's uterus right here. Here is fallopian tubes. Sorry, I'm not a great drawer on these things. This. Now, if you look, these white egg-looking things are going to be the ovaries, and if you look right here, you can see that it's bulging out a little bit. Well, that's where the follicle is at, and it's probably either has just released or will just release very soon an egg that will get taken up by the fallopian tube. You can look at the arrow right there in the direction it's going. Front slide of the uterus. It is pear-shaped. Just so you know, this area up here, we call this the fundus, and we talk about fundus a lot in this class. So, and you'll see, like, especially after we have babies, we need to rub and make sure that this area is staying firm and that the bleeding is staying okay. And we'll get into all the postpartum stuff when we get to those chapters. But I want you to know that this is where the fundus is. It's at the top or the head of the uterus. Different sizes of female pelvises. The one that all the doctors love is the gynecoid. You can tell by looking at it that we have quite a bit of distance between tailbone to symphysis pubis. And then these little areas right here that kind of protrude inward, those are called the ischial spines. And those play into when we start doing cervical exams, we need to find out what station the baby's head's at. So is it low? Is it high? And these ischial spines are actually considered station 0. So, and I'll show you, or hopefully y'all will get a chance to look at a model of a pelvis, and so you can actually see that. The others, now, pelvis A is going to be the most desired for having birth, giving birth vaginally. The other ones place some difficulties. The narrow pelvis, this one down here, pelvis C, it's called an anthropoid. Look how short this area is between here and here. And it's also maybe even a little bit short this way compared to pelvis A. This is very difficult for a baby to pass through. Also, B, the android pelvis, which is typical of males. I know we've all have some friends, that they're just not a lot of hips, kind of straight up and down. This is probably the type of pelvis that they have. And either at B or C, you're looking at more than likely having to have a C-section. D, it's possible if the baby gets in the correct position. It's much wider going left to right between those spines, but it's a bit shorter going this way. Now, baby can make it down there if they're not too big, and if they get their head going in the correct position to get through there. Female breast tissue, you can see what we've got here. These are all of the this is going to be all of your milk ducts right here, and then you have several pores at the end of the nipple that the milk actually comes out of. If you look on this breast tissue over here on the nipple, you can see these little dots that I'm putting the red dots on. Those are called Montgomery glands, and so when a baby latches on, it's going to stimulate those Montgomery glands, and that's going to increase letdown of the milk for the baby. This is the life cycle of an ovarian follicle. So we start over here, right here. This is where several little follicles are trying to develop. One of them will become primary and will get larger than the others, and the others will just end up disintegrating, basically. And so then, it's going to progress. We're going this direction. We're going clockwise. So until we get over to here, this is where the egg is released. So follicle stimulating hormone, we talked about the hormones a little bit before. So follicle stimulating hormone comes from the anterior pituitary, and that's what starts this process over here. This is where we start. And then when we get to over here, where the egg is released, you probably, somewhere between these two stages, you've got luteinizing hormone, and that's the hormone that also comes from the anterior pituitary that causes the egg to be released. So once the egg's released, then we've got what's called a young corpus luteum, and they have it colored in yellow here. That is going to continue to produce progesterone to help maintain the pregnancy in the early stages until that placenta can get developed. And then over here you've got the corpus luteum fully formed. And then if implantation takes over, then that's great. But if not, if there's no pregnancy, then it's going to retrograde into this the albicans, the corpus albicans, and then we start the process all over again. So here we go. This is the menstrual cycle review. So pituitary, it detects, it's a negative feedback endocrine gland, so it's going to detect low levels of estrogen, and when that's going to be right at the end of your menses, so your estrogen's at its lowest at that point, and so it's going to release follicle stimulating hormone, telling the ovaries, go ahead and get ready, let's start making some eggs and get ready for this next cycle. So the ovaries produce estrogen in response to the follicle stimulating hormone, and that allows those follicles to build up, and it also is is going to make that endometrium layer really thick so that when the baby does implant, it's got a good start in life. The pituitary also has the negative feedback. It detects the low levels of progesterone, and so it's going to release that luteinizing hormone. That's what's going to help make these corpus luteums appear that you see. Once the ovary is released, and progesterone is going to be produced in the follicles of the corpus luteum, and high levels of estrogen and progesterone continue until that corpus luteum degenerates and there's no conception. And then after that, estrogen and progesterone fall and we start it all over again. Physiology of the sex act. One interesting thing is that when a woman has an orgasm, that it actually causes the uterus to kind of ball up, I guess is a way to say it. And when it does that, it is actually pulling semen up into the uterus to help with fertilization and implantation. So to help with getting pregnant. That's it for this chapter. We'll get to 3 next.